incredibly common, but because it's so common, there are loads of myths that seem to be circulating around it. So here's some of the facts behind the myths. The first and most common myth that I hear all the time is that the woman comes to blame herself for the miscarriage. She thinks that it's something that she's done or hasn't done that's made it her fault. And I want to say that this is absolutely not the case. Chromosomal abnormalities or genetic abnormalities of the embryo are the commonest reason why women miscarry, and there is nothing that you can do to influence that. It doesn't mean there's anything wrong with you or your partner. This is a chance event that can very commonly occur and sadly lead to miscarriage. Another common belief is that miscarriage risk increases with increasing age of the woman. Under the age of 35, this risk is around 25%. Between 35 to 40, it's more like 33%. And when you get over the age of 40, the risk can go up to about 50%. And the reason behind this is that the eggs which are used to create the baby are in fact more abnormal themselves. They've aged much like the woman has, and therefore can have more chromosomal abnormalities, which is ultimately what influences the risk of miscarriage. Along with maternal age, paternal age is also important, as more and more studies are showing. And this is particularly so with men who are aged over 40, where there are more sperm abnormalities that can contribute to an increased risk of miscarriage. Now, this isn't anywhere near as high as for a woman who may be the same age, but it is still there. Paternal age tends to be associated with single gene defects, which is a different thing that doesn't necessarily lead to miscarriage, but there is still an association. Another belief is that getting sick during pregnancy can cause a miscarriage. Now, this does have a degree of truth to it. Though most common infections, so say for example the flu or a urinary tract infection or a tummy bug, will not cause a miscarriage and in fact are easily treatable, infections such as chlamydia, listeria and rubella, which are far less common, can potentially cause miscarriage. But please remember that these things are very, very uncommon, and if there's any chance you're worried you might have anything like that, please go and see your doctor immediately. Does obesity increase the risk of miscarriage? Well, yes, it does. There seems to be a very definite association from what research has shown us between high body mass index and increased risk of miscarriage. Though we don't quite understand why that is, the association is there. So is a really good reason as to why you should reduce your body mass index before you try to get pregnant. And also in particular because it has implications when you are pregnant and can increase the chance of any obstetric or pregnancy related complications. This is a great myth. Riding a roller coaster can potentially cause a miscarriage. The belief is that, yes, there is a theoretical risk, especially later in pregnancy, that the sudden jerking motion could induce a placental abruption or a shearing of the placenta away from the uterine wall. And because of this, and because no one really knows, it's generally advised that women stay away from amusement parks and from roller coaster rides if they're pregnant. Can being hit in the abdomen or tummy cause a miscarriage? Well, in the majority of cases where this is very minor trauma, it doesn't necessarily lead to anything that could be abnormal or that could induce a miscarriage. Later in pregnancy, sudden jerking motions could potentially induce what's called placental abruption or the shearing of the placenta away from the placental wall. Now, if the fall or trauma is quite significant, so in a motor vehicle accident or a head-on collision, then this of course can be quite serious and could potentially give rise to a miscarriage. So it's absolutely important that you seek the help of any specialist or doctor if that is the case. Can an abnormally shaped uterus induce a miscarriage? So there is some truth to this, but it depends on what shape of uterus it is. There are all sorts of uterine malformations out there, and there are some which have a slightly higher association with subfertility as well. Now, if there is a septum in your uterus, depending on the degree of septation or how long it is, this potentially could be associated with a miscarriage. So really important you get a proper ultrasound scan and assessment and see a doctor about that. One of the commonest myths that I hear all of the time is that of believing that progesterone can prevent a miscarriage. In terms of all of the literature and loads of studies that have been done out there, there is no consensus or agreement that this is the case, and certainly not if you've conceived naturally. If you're having IVF, then yes, progesterone is important, and in practically all of the cases, the doctor will give you progesterone supplementation. Also, there is a small subset of women who experience recurrent miscarriage, so that's 3 or more consecutive miscarriages where progesterone may be of benefit. But for the majority of women, buying over-the-counter progesterone creams that may not even be active in themselves is not going to have any beneficial effect as far as we are aware. So always make sure you discuss this with your doctor, and if your doctor advises you to take any supplements, they will prescribe that themselves. Do you need to wait before trying again after you've had a first trimester miscarriage? Well, there's no evidence to say there's a set period of time that you have to wait. This depends on how long it takes you to emotionally and physically recover from your miscarriage, in particular if you've had any treatment done. But as a general consensus, we advise you to wait for at least 1 normal period, if not 2 normal periods, before you start to try again. Can you have sex when you're pregnant and not risk miscarriage? Well, the traditional myth that circulated was that you should abstain from sex for the entire pregnancy, but actually the truth of the matter is there's very few women who need to abstain from sex, and those are women with something called placenta previa or cervical insufficiency, and you will know if you have that because your obstetrician will have told you. Should you avoid all cheese and deli meat when you're pregnant to try and avoid miscarriage? Well, this is partially true. Certainly, women who are pregnant are more prone to food poisoning, and things like Listeria, E. coli, Salmonella, and toxoplasmosis, which can be picked up through cheese or meat, can certainly cause some problems and potentially miscarriage. However, there are cheeses and meats that can be eaten. You just have to make sure that they're pasteurized. Generally try and avoid soft cheese, and meats need to be thoroughly cooked and prepared. Can being in a hot tub or hot bath cause a miscarriage? Well, generally speaking, we as experts tend to recommend that women avoid it throughout their pregnancy. And this is because submersion of your body in a hot bath can increase your overall body temperature, which can potentially have negative effects and has been associated with neural tube defects. So to be on the safe side, try and avoid very hot baths and also hot tubs whilst you're pregnant. Should you exercise when you're pregnant? Well, traditionally, most women were told not to, but the majority of experts now agree that, in fact, it's really important you do exercise when you're pregnant. And the Canadian guidelines recommend 150 minutes per week. So that's 20 to 30 minutes a day, which is a combination of aerobic and anaerobic exercise. It's important to help to reduce the risk of any pregnancy-related complications like preeclampsia, and it also helps to lift your mood and make you feel better, improving blood flow to the baby and to the pelvis. Can birth control pills cause miscarriage? Well, though we do commonly give a very high dose of birth control to induce a miscarriage in a woman who doesn't want to keep the pregnancy, being on birth control when you've conceived, and if you don't realise that, hasn't been shown to induce any miscarriage. So take some reassurance from that. And there's also no evidence to suggest that being on birth control, like the pill, increases the risk of any future miscarriages. Can taking aspirin during pregnancy cause you to miscarry? Well, this isn't true because actually we can give aspirin for women in early pregnancy, in particular if they've got conditions like antiphospholipid syndrome, which can cause their blood to clot. And sometimes actually aspirin is continued throughout the pregnancy to reduce the risk of clotting or reduce the risk of preeclampsia. However, taking non-steroidal anti-inflammatory drugs, so things like ibuprofen, can increase the risk of miscarriage, so these things should be avoided. Can stress cause miscarriage? This is a really difficult one because actually the truth of the matter is that we don't know. We certainly know that stress can increase the amount of cortisol and adrenaline in our bodies. These are the stress hormones, which can be counterproductive. Can they cause miscarriage in themselves? The jury is out. There are some studies that are suggesting a biological link between too much stress or major stresses and life events and miscarriage, but actually we don't know. The recommendation is, as with anything, to try and keep your stress levels down if you can and try and focus on working with that where you can. Can a surgical abortion, or a D&C as we call it, cause a miscarriage in the future? Well, this is very unlikely. Surgical abortions are very common, and in the majority of cases, 1 or 2 of these is not likely to cause any increased risk of miscarriage in the future. However, having multiple surgical abortions or D&Cs, because you're instrumenting the womb and uterus, could cause some scarring and adhesions to form, which could increase the risk of miscarriage. So yes, there is some truth to this. can having an internal or transvaginal ultrasound scan or even an abdominal scan cause a miscarriage? Well, this of course is not true, because a doctor would never actively put you at risk of miscarriage, and the settings that we use on the machines to perform the scan are such as to cause minimal risk of anything like that. So please don't worry about that being a risk. Transvaginal scanning in the early stages of your pregnancy, in particular for reassurance, is very common and is safe to use.